Well, good afternoon. Thank you, everyone, for joining us via live stream broadcast. My name is Jonathan Cook. I'm the Executive Director with Solano Pride Center. Joining me from our staff is Adrian Asben. He's our project coordinator. And I'm very pleased to introduce two of our panelists for this afternoon. Joining us online is Supervisor Erin Hannigan. She is the chair of the Solano County Board of Supervisors. And we also have with us Mayor Bob Sampayan. He is the mayor of Vallejo, California. So welcome, Mayor. Thank you so much for joining us.
And thank you so very much for the invitation. It's truly an honor to be here. And I'm excited to chat. You know, whatever it is we're going to be talking about, and I'm assuming it's going to be about CV-19 and what's going on. Yeah, we can have a very robust discussion. I know Supervisor Hannigan has been really involved in what's going on in the county. So City of Vallejo is relying on the expertise of the county as well as the state. So as we progress in this conversation, Erin and I will be bouncing back and forth with it. So thank you.
Excellent. Yes. And before we jump in, I'd just like to acknowledge that this Q-Chat series is funded in part by Solano County Behavioral Health and the UC Davis Center for Reducing Health Disparities. And Adrian can tell us a little bit more about that project.
Yeah, definitely. So yeah, we're funded under the Solano County Innovations Project with behavioral health. And what the project's meant to do is reduce stigma around mental health in general. Solano County found that they found 3 target communities. 2 were because of low penetration rates, which meant that those communities didn't use the resources as much as the average for California. So that was the Latinx community and the Filipino community. When it came to the LGBTQ community, unfortunately, the county had no data, and LGBTQ folks do suffer more from mental health, whether it's substance abuse, depression, suicide. So those were the 3 target communities, and the county picked 3 CBOs, and we got lucky to be that CBO, a community-based organization, in order to be the liaison into the community. So so this chat series is basically a way to talk to community, talk about issues that affect the community, and yeah, that's what we're doing. So thank you, everybody, for tuning in.
Yeah, that was a nice summary, Adrian. So as he mentioned, we work with the LGBT community as part of this collaborative. And the other 2 CBOs that we're fortunate to work with in partnership is with Rio Vista Care, who is our partner and working with the Latino community, and with Fighting Back Partnership in Vallejo, who is focusing on the Filipino community for this project as well. So just obviously the context that we are all talking about currently is around COVID-19 and the way it's disrupted our lives. From the LGBT community's perspective, we have definitely seen an increase in demand for mental health services, anxiety, depression, and all of those concerns, isolation, especially for our seniors. So fortunately at the center, we're able to provide our services mostly virtually. So we're able to continue our free counseling services via phone or through an online platform like this. We're still offering 2 weekly youth groups, and we're able to meet with our LGBT seniors, our Rainbow Seniors program, every week as well, and providing some emergency food assistance. So thankfully, we're able to come together. We're working with a bunch of great organizations, CBOs, and nonprofits across Solano County. But I wanted to take this opportunity to speak with both of you and to thank you both for the great time and effort that you're putting into making sure that our community is healthy from a public health standpoint. Supervisor Hannigan, I will kick it off to you first to kind of talk about the context and where we're at with Solano County's response to COVID-19 in the county.
We are very, very fortunate that the county has done a great job of monitoring that, and they have partnered with Kaiser. Kaiser has furnished people to replace the certified nursing assistants with LVNs and RNs, which has caused them to staff up and provide better care, which I'm very, very pleased with. At today's tri-weekly county update, Dr. Matyas said that it appears that our curve is starting to flatten, and that's a good thing to hear. As long as we practice the social distancing, that we wear our masks, that we do what is being asked of the county and of the state, we can kick this. My fear is that if we don't, we'll have a resurgence of the virus as we've seen in Texas and in Florida. They're starting to increase because they just walked away from any of the rules. Now they're starting to increase. I don't want that to happen to Solano County, to California, to any state. So we need to be cognizant of those rules. That is where we are on CV-19. But there are a bunch of other things, but I don't want to take all the time away from the supervisor.
Yeah, well, thank you for kicking us off and framing it that way. I appreciate it, and appreciate the leadership from Vallejo. I'll kick it over to you, Supervisor Hannigan. The latest with the response from public health and where we're at with guidance from the state Department of Public Health on the different phases of reopening and where we're at with that.
Yeah, I appreciate the question. I think it's, this is a whole new world in terms of how we conduct business, and that we are truly being controlled by the virus itself. So on March 18th, the county, because we have a county public health officer, we submitted a stay-at-home order. It was effective immediately for all residents in Solano County, and we essentially only allowed folks, and this is considered phase one, the opportunity to go and pick up groceries or go get gas, or if you have an essential job, to go to your job as well. The shelter at home meant that most people were at home, school-age kids, the whole bit. And that was to protect you, because we knew that the virus was in our community in some way, some form or fashion. It isn't something you could see. It isn't something that, is easily recognizable. In fact, 80% of the folks who test positive are asymptomatic. And so we needed to stop the spread, and that's why we sent people home. That's phase one. Phase two, of which we are through the first half of phase two, was to allow for non-essential businesses, curbside pickup at a store, things along those lines. And the governor's has put out direction in terms of the counties being able to move forward through the phases. And so the first part of phase two was our choice to move forward. We did at that point also not put an end date on our order. So our stay-at-home order is effective until we are no longer at risk of catching the virus. And the public health is restored, if you will. The governor switched phase two into two different segments. And to go to the second segment, which is essentially dine-in restaurants and a few other things, the governor's office originally had a requirement that you could not have, one of the requirements, because there's many, was that no fatalities in 14 days. Well, as Mayor Sampayan shared, the outbreak at Windsor, which has been horrific, really has, we would not have been able to comply because of the fatalities that occurred there. So last week, as a result of the governor's requirements for going forward with the second part of phase two, we submitted a attestation requesting a variance because the outbreak that is happening at Windsor is controlled and it is contained. Meaning that, the patients who are there who tested positive have been moved into their own areas. And then the staff members who have also tested positive have been traced and tracked and quarantined. So we've stopped that virus from coming into our community, and the fatalities are not representative of community spread, which is, this is all new terminology, right? We didn't know any of this stuff before. So we have filed a second attestation because the rules changed this last Monday. Coming into the week, we had submitted our first attestation, asking for forgiveness to go ahead and open up, even though we've had fatalities. And in the second round of changes, which happened over the weekend before we were allowed, was that they removed the fatality, but we had to again submit another attestation variance. And that was notified to county leaders on Sunday. The governor shared it with the public on Monday, and Monday night he had submitted a different form, a new form, a much more intensive form that the county had to complete, along with letters from hospitals in our county saying that they were, that they had, they had capacity. And so that has been sent to the governor's office, and we're anticipating that we will get a go-ahead because we're not looking to for a forgiveness for a particular requirement that we may not have met. We now meet all of the requirements. We're just looking for his concurrence that we can move forward. And as we heard today, Napa was given that concurrence today as well. So what I've been sharing with businesses, particularly restaurants, but really any business owner that I've come in contact with, and I know the city's also doing this, is getting them prepared for when it's a go. Knowing what the protocols are in order for you to operate your business safely for customers to come in and spend money or, have a meal, whatever it is. And so businesses really need to be prepared. On our solanocounty.com website, COVID, we do have resources for businesses as well. It's really a wealth of information on COVID, following the CDC guidelines, following the CDPH guidelines, et cetera. We do have a a dashboard on the website as well that tells you how many positive cases we've had in the county, talks about hospitalizations, number of active cases. So far, we have 435 total positive cases in the county. We've had, unfortunately, 18 people have passed as a result of the virus. We have 43 active cases right now, and 18 of those folks are in the hospital. So that gives you an idea of the information that we're getting and what it looks like in our community. I would like to share with everybody, please get tested. There are two test sites in Solano County. At that COVID site on the county web page is a website as well as a toll-free number that you can contact to get your specific ID number, date, and time when you get your test. I was tested. I was negative at that point in time when I took the test. So we're hoping, we're trying to figure out how do we live with COVID safely. And if we find that we've gone too far, then we are very much willing to pull all the way back to a stay-at-home order again. So we need to be clear that we are still living with the virus. Just because we're allowing people to open their businesses doesn't mean it's gone away. And we are very much pushing wearing masks, social distancing, physically distancing, washing hands frequently if you don't feel well, stay kind of stuff. So just want to remind people of that.
Well, thank you. Now, just from my understanding, the two testing sites in the county are in Vacaville and Vallejo. Is that correct?
Mm-hmm.
Okay, wonderful. Well, that's good to hear about the partnership with Kaiser as well. I understand that they have a lab that they're rapidly building in Berkeley where they're trying to get to the capacity to be able to process 10,000 tests a day. So it's quite a remarkable thing that we're having to build the airplane while we're flying, for lack of a better metaphor. I have a few questions. So just from listening to you both, kind of the coordination and collaboration between different levels of government. So how can the county and different cities, the 7 cities within Solano, work together? Mayor Sampayan was mentioning a new city ordinance about masks, and of course there's the county order about social distancing. Is it more of a social contract where we're encouraging folks to have a mask? A concern of mine working with a lot of low-income folks is, the ability or the inability, rather, for some folks to be able to access a mask. Is it more of a social contract where we're asking folks to comply, or is there an enforcement piece? I guess that's a question for you both.
I'll go ahead and take that one, Jonathan. Thank you for the question. It is more of a social contract. Enforceability is going to be difficult. Our police department is a busy police department, and the resources aren't there to go to call of people not wearing masks. However, I do want to say that we do have a person that is dedicated to contacting businesses that are not doing social distancing, that are not wearing masks, and that is Annette Taylor in our economic development department. So if she receives a report, or if we refer something to her of a business that's not in compliance, she sends them a letter, or we'll go out and pay them a visit. And we've had pretty good compliance rates when we've had those types of complaints brought to us. And she fires off a letter, goes out and does an inspection, and finds that they are doing exactly that. I truly believe that the majority of people have good intentions and will wear a mask. When my wife and I go to Safeway to shop, we see the majority of folks wearing masks. The majority of people are following the one way of the aisles. People are wearing gloves. People are following the standing positions when it comes to checkout. So, quite frankly, I do believe that the majority of folks will follow it. Now, when you say that folks can't afford masks, I understand that. However, face coverings can be virtually a t-shirt. It could be something as simple as cutting the sleeve off of an old shirt and putting it over your face. So there are many ways of covering your nose and your mouth to prevent the spread, and also following the what's the new phrase, sneeze protocol, where you're preventing the sneeze from being broadcast throughout the environment that you're in. Yeah, very good, Supervisor, exactly that. So there are many things that people can do to prevent the spread, and I truly believe a lot of folks are willing to do that. They don't want to get sick. Yeah, of course, there'll be the ones that say you're infringing on my rights, or that kind of an attitude. But those folks get shamed, and it's compliance by shaming. I hate to see that, but the bottom line is that we, as a society, are concerned about our well-being and our safety. And I truly believe that the majority of folks are willing to go along with it. I want to comment very quickly. Supervisor Hannigan mentioned the county webpage. The city has a webpage also, cityofvallejo.net, cityofvallejo.net. And on our webpage, there is a lot of information about CV-19, and it has everything in there from business plans, business reopening, how to get help. It has a senior hotline. So there's a lot of stuff that's there for people to look at if they really would like the information.
Yeah, thank you very much, Mayor. I guess another place that my thoughts have recently gone in speaking with some of my colleagues is that, we're entering the summer months, and we're starting to have a little bit more containment with the virus. What is the plan for the fall? I mean, if there is a second wave, if we're to expect something like that, are we at the capacity to offer contact tracing? Will some of these measures have to come back into place? Do the hospitals in Solano have enough ventilators? Those are some of the discussions that I've been hearing recently. Supervisor Hannigan, if you want to comment on that, perhaps.
Yeah, and I do appreciate that question as well. So I've asked my Dr. Matthias, Bela Matthias, who is our public health officer, do we have enough contract tracers? He said we have over 65 for the county. So contact tracing is not something new to the county and certainly not to public health. Every year we have, pretty much every year, a TB breakout that occurs, which requires contact tracing. And so public health staff is very familiar with that process and how it goes forward. And like I said, if the virus becomes overwhelmed, if again, instead of going flat, we're seeing an increase in the number of people who are testing positive, or really where we're going to see it probably first is in our hospitals, then we are fully prepared to go back to stay-at-home order and only have essential businesses open. It's just a risk that's too great that the county doesn't want to flirt too much. So, we want to help people stay healthy. I think, and this is a conversation I've had with folks who have shared that they're scared that we're going too fast, that even if we open up businesses or restaurants, they're not going to go because they just feel really scared. And, they're over 65, they have underlying health conditions and should be scared. I mean, we think we all should really be scared because we don't know. I mean, it's done different things to different people. You can have the healthiest, Adrian, you can have Adrian, this healthy young man, you too, Jonathan, and you can have a poor outcome. It's just, it doesn't discriminate. And so we need to realize that we live with this virus, and it comes down to personal responsibility and making your own choice to engage or disengage. And it's okay not to engage until we have a vaccine. This is how we're going to live, I feel. And so we are prepared come fall in the event that there is a greater outbreak that occurs in the community in Solano County to go back to a shelter at home. I think we're very fortunate with the hospitals that we have. North Bay, not so much because it's very specific to Solano County, but with Kaiser and Sutter have huge networks of hospitals. And one of the things they're able to do because of that is move patients among them. So the hospitals that are in our county aren't our only resource. They have other places that they can move patients to accommodate an outbreak. And I think one of the benefits we have lots of benefits for living in Solano County, but I think one of the big ones is we are very suburban and rural. And we're not living on top of each other like in San Francisco or maybe even San Jose or some of these other larger cities that are experiencing greater outbreaks. And so I think that protects us in a lot of ways. But, again, it's personal choice, personal responsibility. And that's why I say, and face coverings, that's the term. We're quickly to say mask, but face coverings, it really can be anything. It could be a t-shirt, wrapped around your head. There are so many different ways you can protect yourself.
Yeah. Well, thank you for that. That was very helpful. I just wanted to update the audience as well. So fortunately, through the County Office of Emergency Services, we were able to procure some PPE, including masks and gloves. So that's something we're working with as we begin to phase and start opening to having in-person counseling services. That's going to be part of our procedures, is making sure that staff are sanitizing our workspace and offering masks to our clients. So we're grateful to the county for being able to provide those resources to nonprofits who can't access them on the market like a lot of our medical providers are able to. So I wanted to give a shout out to the county for that.
I did want to make a comment about folks with underlying health conditions, because that's kind of that's the risky heart. You know, you're not necessarily more susceptible to the virus, but you're more susceptible to a poor outcome or a requirement of an ICU bed and a ventilator. And what it comes down to is, one, if you've been diagnosed with diabetes or a heart condition or high blood pressure, please have it under control. Take your medication, follow the doctor's orders, because having unmitigated underlying health conditions is, stay home, because you're not going to have a good outcome. But now is really the opportunity to create that relationship with your doctor. If you don't have one, find a doctor, have that conversation with them. How do I control my diabetes? How do I control my heart condition or my high blood pressure? And make sure that you're following those rules, because, you know, you don't have to be the one that gets really sick. You can actually mitigate that by taking care of your own health.
And Jonathan, I'd like to expand on that just a little bit more, if I may.
Sure.
Listening to what Dr. Matias has told us, the at-risk population are the Asian Americans, Pacific Islanders, and the African Americans. And it's based on uncontrolled diabetes and hypertension. And I really have to echo what the supervisor just said. Those particular folks really need to check with their physicians to make sure that they keep the diabetes and the hypertension under control. Now is not the time to say, I'm not going to worry about it. It'll be okay. Now is the time to get the test done and to move yourself forward into that category of, yeah, I'm all right. It's very, very critical, in particular for the elderly in those vulnerable areas.
Yeah, thank you very much, Mayor, for echoing that. That's something that we have been aware of as well from the center, working with our colleagues Fighting Back and Rio Vista Care, just, you know, marginalized communities especially. We've realized, working with UC Davis with their Center for Reducing Health Disparities, is that, you know, just general access to healthcare is lower in a lot of these populations. Poverty contributes to that, as I know both of you are very, very aware. We did have a few questions from the audience. I know Adrian was mentioning that we had one around vaccines and antibody tests. Did you want to go ahead with that, Adrian?
Yeah, so I had, so there's one, give me 1 second, so I have to look back on it. So one of the questions is, yeah, so when it comes to when the vaccine comes out, how is that going to be distributed throughout the county?
That's $1 million question.
Yeah.
Supervisor, I'm going to hand that one off to you.
Yeah, that's fine. Well, I hope we would utilize our already established healthcare system. You know, we're very fortunate in Solano County to have 3 hospitals and many clinics. You know, Clinic Olay, La Clinica. The county has its own clinics, so there are going to be plenty of places to actually receive a vaccine if and when that vaccine comes. That is a good question.
Now,
and I would agree with what the supervisor says. In Vallejo, we're very, very fortunate to have Kaiser, have Sutter, we have La Clinica, and there are other community-based organizations that are healthcare-based. And hoping that it will happen sooner than later, that these vaccines become available, that they will be made available to these healthcare organizations that will be able to start doing the immunization. And again, because of those folks that we have in Vallejo, I feel very confident that if the vaccine amount is plentiful, that we can vaccinate everybody. And I know that through the county, that will be a very, very coordinated effort, because we don't want to see what we have just seen over these past several months.
Now, are we also partnering with some of our educational institutions? I know, like, there's the medical school with Touro University there in Vallejo. I would imagine they would be a great resource for both the county and the city.
Absolutely. Thoreau has already stepped up. They want to help us with our testing, in particular with our homeless population, the unsheltered, the elderly community, the board and care homes, uh, and those facilities that house a lot of the infirm population. They've stepped up to say, yes, we can help. They've got a nursing program that is high end, and they are all but willing to come out to help. And I'm very pleased with that. We also have, La Clinica, who's very active in our community, and they're doing the same thing. In fact, La Clinica has been doing our city employees testing. So it's all coming together, it's all working together, and we're working with folks from the county to make sure that we do as much as we can to look this virus in the face to say go away.
Mm-hmm.
So I'll just add on, the county is also partnered with Solano Community College, their nursing students. They are in our Office of Emergency Services. We have a bank of phones, as you can imagine, in a place like that. And they are actively calling anybody over the age of 65. It's a hotline that they are sharing. 784-1607 is the phone number. 707-784-1607. And that hotline, you can be proactive and call the hotline if you need help. And they've helped people who are homebound and do not necessarily have that lifeline outside of the front door. They've gone to Travis Air Force Base to pick up medication for a person, I should say. They've mowed a lawn in Vacaville, somebody needed their lawn mowed. Providing
They delivered food to the 2 blind people.
Yeah, food and masks, and they're being proactive in calling out, but we're also receiving calls in. But just checking on people, and that's something else I'd like to share with everybody is check on your neighbors. You know who your neighbors are and who's elderly. You've seen them come and go. Knock on the door, step 6 feet back, and just find out if they're okay, if there's anything they need. There's definitely resources out there for them.
Wonderful. Yeah, it's been a really great thing to see all of the collaboration between county, city, different CBOs who are working with seniors. I know that's been a concern for us with a lot of our seniors. As folks may not be aware of, the majority of people living with HIV and AIDS are now above 50, which is a great thing because they've survived. But the largest percentage are folks who are getting up to those senior years. So, with different comorbidities, if they also have diabetes or something like that, that's definitely a concern. So, I think I saw a question, Adrian, about senior facilities. Did you want to expand on that?
I want to ask that next, but because there's another question that is coming off the vaccine. So I have a question that basically asks, are the vaccines basically going to be mandatory? And this is pertaining to anti-vaxxers. Or is it going to be enforced? Or is there going to be consequences for folks that choose not to vaccinate? Is that even a conversation? But yeah, I'll leave it.
It's not a conversation at my level. I mean, if you don't want it, then don't get it. But I mean, I think, no, I don't think there's any consequences other than the risk of getting the virus and hopefully being in the 80% who are asymptomatic.
And quite frankly, Adrian, why would you not want to get vaccinated if you know that you will not catch the virus?
Yeah.
I get it. It's your constitutional right. If you don't want to do it, okay, don't do it.
Catch it or be a carrier,
Yeah, catch it or be a carrier. Good point, Aaron. And the bottom line is, if you want to be a statistic, that's up to you. I think those of us that are here right now agree that it would be the prudent thing to do to get vaccinated when this vaccine comes available, because none of us want to be statistics.
Yeah. And hopefully that'll be just like the small minority of folks that are choosing not to wear their face mask. Hopefully it'll be a very small group.
Right.
Yeah. And then the other question was pertaining to senior homes. It asks, when will independent senior facilities be able to open to new participants?
Well, in Vallejo right now, what we're doing is we're looking at the board and care homes. We have 263 of those in our city, and some of them have as many as 7 residents. What we're looking at is making sure that the residents of these board and care facilities are being tested. There are some that are ambulatory, but there's half as many that aren't. So we are recommending that the ambulatory folks go to the county testing sites, and the non-ambulatory, we will have a mechanism available, partnering with the county, partnering with Thoreau, partnering with La Clinica, to go out to these board and care facilities to test people. The other thing that has me concerned are some of our senior hotels. We have a couple of those in town, and I've asked that we try to find a way to get testing for those people. We also have, well, for instance, the Marina Towers. That's a huge building that has probably close to 600 people living there. Can we test them? Do we have the availability to go in and make sure these folks are okay? And that's a conversation I'm having with our housing department. They're the ones that are coordinating all this, as well as our assistant city manager and Cardwell. So we're trying to get as much testing as we can in all these facilities. And I go directly to your question, Adrian. Are these opening up? Until we get the green light from the county, we are not, I believe that these places are not going to open up to accept more clients, if that was what the question was all about.
Yeah.
Now, my other question. So I would imagine that the 2 testing sites in both Vallejo and Vacaville, are those managed by the State Department of Public Health?
Yeah, so it's an independent, they're independent. I think the contract might be managed by the state. But just for the public, the testing is for anybody. You don't have to be symptomatic to get a test, and we're actually encouraging people, please go get tested. You know, for the county, it's one way to do a check-in on the health of the community. You will get your test results in 48 to 72 hours. I took the test. It is very uncomfortable. It's, you know, the swab all the way to your brain, and then they turn it a few times. It's the cleanest nostril. Anyway, it's very well done. I mean, it's pretty amazing how organized it is, and you can't just walk into those spaces. On our Solano County website is a testing notification, if you will, and there's a website and a toll-free number you can call to get a date and a time and a personal number for when you do go.
And will that continue to be free for all Solano residents?
Oh yeah, for as long as we can do it. Yeah.
Excellent. Okay.
Aaron, you might want to add that according to Jerry Huber, that it was going to extend beyond the 31st.
Yeah, it's we're looking at that. Yeah, I think has he done that? I don't know if has he.
I had heard that he had, but I don't know how far it's extended
I mean,
out.
I can tell you, we want it for as long as we can have it. You know, the testing capability. It's in our best interest to know what is happening in our community. So while it's there, please get on there and get a number. Go get your test.
I can't emphasize that enough. Especially if you're at the vulnerable age or you're in those categories of folks that I just mentioned, go down and get tested. No, they don't take it up to your brain. I've heard that one, but it feels that way. They do stick it up pretty far. It's uncomfortable for about a second, literally, for about a second, and it's over.
Excellent.
So, well, I get it, but it's best to know than not to know.
Yeah. Agreed.
It's like we tell our clients, with our HIV clinic, it's, get tested, know your status. You can't really control any of those outcomes unless you're aware of what your status is, whether it's positive
Very
or negative.
good.
So,
Very
Well,
good,
and that goes
Jonathan.
back to
Well
like
said.
if you're positive for diabetes,
Right.
take those, do what you need to do to protect yourself and make yourself, healthier.
absolutely.
Great advice.
Now the next area I want to touch on before we get closer to closing is around economics. Obviously, this has had a huge financial and economic impact. It breaks my heart as, the center is a member of several chambers of commerce, including Vallejo. So we are very much interested in making sure that the economic viability of our small businesses and our downtown areas is, sustainable. What are ways that, residents can support their communities, their small businesses, restaurants right now? What are some recommendations from you both?
Well, I would say order takeout. keep your restaurants alive as much as you can by ordering food from them. I think there's the health of the business, and there's also the economic health of the employees. Small business owners are our largest employer overall, and so we need to be cognizant of, for each small business, there's 2 or 20 or 30 individuals who relied on that business for an income, and we need to keep that in mind, and I would say shop local as also, but be careful. Make sure that you've got your face covering on, that you're practicing social distancing, you're washing your hands, you're following the rules, because that'll keep them alive even longer.
Mm-hmm.
And Jonathan, for the city of Vallejo, it's really difficult for us. We've seen a substantial loss of tax revenue, and I'm thankful that we don't have to lay off, furlough, let go any of our employees. We've been able to manage the lack of revenue by working with by not doing projects, by monitoring our expenses. Like, one of the big things was a $1 million fire truck that we were thinking of getting, and it was on the replacement rolls, but we're holding off on that. So that's $1 million that can go to something else. So our capital improvement plan is, right now, it's on hold, and we want to see where we're going to go financially over the next few months. Depending on what happens with this new stimulus package, if it gets past the Senate, that could help us out quite a bit, because that stimulus money will go to our businesses, will go to the people that really need the money. I talk to business people every day, and all I'm hearing is, I've had to let X amount of people go. I've had to, it's the one of our breweries. It is the owner and half dozen of his executive team that have the brewery going.
Mm-hmm.
His comment to me was, he can bring these people back, but their salary is not going to be what it was. So he's excited about when they can reopen, because, like any other business, it's what is sold and how much is sold. And with the distilleries being closed, the wineries being closed, the brew houses being closed, it really hurts. So I encourage our residents to shop locally, to patronize those businesses that have takeout service. There are so many of them. Ramona and I hit as many of those a week as we can. I haven't eaten out as much in my life as I have over the past couple months, but it's definitely a good variety. And I don't want to discriminate against any particular industry, but go pick it up yourself. Drive down, go get it, because that's less money that purveyor has to spend to get you their product.
Right, definitely.
So yeah, that's
Well,
what we're trying to do.
Wonderful. And Supervisor, did you have any tips about local businesses to support, or kind of the financial forecast for the county?
Well, I think I expressed my, what I know about local business and the challenges that they're facing right now, and that, we need to frequent our local businesses as much as we can. I know there's some that are actually shipping things. I have a business that I frequented before, that I've ordered products from, and they've, sent them to me. So businesses are operating. But from the county perspective and our economics, this is a big hit. But we do have pots of money set aside to absorb these kinds of hits. But like the mayor said with the city of Vallejo, you put a hiring freeze on. I mean, there's just certain things you don't go forward with at this time, and that's where we are at the moment. We have adjusted our budgeting process. Normally, we hear our proposed budget in June. We're still going to do that, but we're not going to adopt it until September, because a lot of the funding for counties comes from the state and the federal government. And both the state is, the January budget, can we bring that back? Because that May is horrible. So, we really have to see how it all shakes out. The governor is allowed for people to file their personal taxes, their income taxes late. And so that affects our bottom line. The sales tax reduction, the lack of fees or any kind of activity happening right now has reduced our income and revenue. So there's absolutely no fluff. I'm anxious to see what the proposed budget looks like. I've said a couple of times throughout this process that this feels a little bit like bankruptcy, just because of how austere and how damaging this has been in terms of budgets. But that can't be what we front with. We front with the health of our community, and that we're not going to have revenue if we don't have a healthy community. So we have to put it into perspective.
Before we end, I wanted to give you both a chance. Updates. So we very much appreciate the partnership that we have with both of you as leaders from the Board of Supervisors and from the City of Vallejo, especially when it comes to Pride Month in June. So I understand that both of you will be issuing a proclamation recognizing June as LGBTQ Pride Month and raising the Pride flag. Did you want to share the date for that, Supervisor Hannigan?
Yes, we will be sharing the county proclamation on June 2nd, and we will be hoisting the Pride flag on June 8th through the 15th. And so looking forward to that event. You can see us, you can watch us at solanocounty.com at the board meeting and see that being presented. We are allowing very few people into the boardroom. Just because that's just, social distancing. But yeah, very much looking forward to it.
Well, thank you very much. Yeah. And Mr. Mayor.
It's always full of activities, right? June is? Oh my gosh.
Yeah, you guys are.
We're going to have withdrawals.
Yeah, we're definitely having to take a hiatus on some of those, unfortunately. But we'll do as much as we can.
Thank you, Jonathan. The City of Laylow will be raising the Pride flag on June 1st. It'll be in the morning. When I had spoken to a couple of your members, Tom Bilbo in particular, we are a little concerned about the social distancing because we've always had a celebration at the flagpole when we've raised the flag. And that, for me, has been, a real exciting day for us because it celebrates our diversity. And we may not be able to do that this time. I have a proclamation that I've authored that we will be reading, but it will be at a council meeting in June where I can physically have members of Solano Pride come to the council meeting, or I can present you with the proclamation after I've read it. So I'm hoping that that will be the first meeting of our council in June, but you will be notified for when that will happen. But for sure, the first will be the day we raise the pride flag. And it'll
Wonderful.
fly for the
Well,
month.
Well, thank you very much. We definitely appreciate the leadership from both of you on this. I think at last count, there's 5 of the Solano cities that are recognizing the proclamation. We've still got to work on
Yay.
the pride flag for a few of the other cities. Currently, it's just Benicia, Vallejo, and the county who do that. So we keep going forward on that advocacy work, but we certainly appreciate your leadership. I know you're both very busy people, so thank you so much for taking the time to chat with us this afternoon. And we appreciate again the work that you're doing to keep our communities safe. So thank you very much to both of you.
Great. Thank you. Thank you.
Thank you very much for the work you're doing, and stay well, all.
Yes.
You too. Thank you so much.
Likewise.
Okay. Good afternoon.
Bye-bye.
Bye.
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 Bye, Aaron.
Out of here.
See ya.
Bye. Oh.